Okay, today we're going to talk about facials. So besides being very relaxing, facial treatments can offer many improvements to the appearance of the skin. Proper skincare can make oily skin look cleaner and healthier, dry skin look and feel more moist and supple, and aging skin look smoother, firmer, and less wrinkled. A combination of good salon facial treatments and effective individualized home care will show visible results. So, conducting a consultation and skin analysis. Analysis determines the skin type, skin condition, and needed treatment. Consultation allows you to ask questions about the client's health, skincare history, and to advise the client about needed home care regimens. So a client intake form helps to identify any contraindications that might prevent skincare treatments. Contraindications include isotretinoin, Accutane, Retin-A, which is a topical form of tretinoin, Reno, Tazorac, or Differin, these are all brand names, pregnancy, metal bones, pins or plates, pacemakers, or other heart conditions, and known allergies. So as we discussed in hair removal, Accutane and retinols can thin the skin. So we have to treat them gently. In the case of Accutane, this is an oral form of the drug, and it completely shuts down your oil glands, so the client will have no oil. So you know you're going to go really emollient, very sensitive, delicate skin as far as your product selection. The topicals, tretinoin, Retin-A, again, they thin the skin. So if you determine that it's okay to give them a facial, of course, we wouldn't be doing any exfoliants. We'd go very gentle. You know, it would be more of a basic facial where you're cleansing, massaging, moisturizing. You really would not want to go any further than that because of the fact that they're on this medication. Pregnancy, you don't want to use any electrical treatments like microcurrent or high frequency. Pregnant women can develop sensitivities. Any of you that have become a mother, you know that your senses can get heightened, smells can become more noticeable. So you need to take that into consideration. Metal bone pins or plates, if the client has any pins or plates, you need to avoid all electrical treatments as electricity may affect metal. Pacemakers or other heart conditions, you should avoid all electrical treatments. Electricity can possibly affect rhythms and pacemakers, and any known allergies to essential oils, fragrances, where some type of reaction can occur. Other contraindications is seizures or epilepsy, use of oral steroids, autoimmune diseases such as lupus, diabetes, use of blood thinners, sensitive redness-prone skin, any open sores, herpes simplex, cold sores, or any recent facial surgery or laser treatments. So if any of these are present, we would probably want to pass on doing the facial for the client. But again, as a educated professional, you can make those determinations as you consult with your client. Some of them will be an absolute no, such as the herpes simplex, if there's a cold sore present, facial surgeries, lasers, any use of oral steroids, seizures, or epilepsy. But you can determine and talk with your client. Record keeping, we would need to keep client data. The client's occupation, date of birth, medical conditions, medications, previous treatments, and home care recommendations. It is good to write these things down or to store them electronically because you think you'll remember. And if you start getting busy and your clientele grows, it's hard to keep up with everybody. So you want information on any skincare products that they are currently using. Some things that they're using currently may be able to stay in place, but maybe you just want to add something else to help rev up what they're already doing. Determining skin type during the skin analysis, we will have read the health screening form. We will have the client change into a smock. We will seat the client in a chair. We will drape the client, have them remove their jewelry. You usually want to have a little dish on your counter that they can place their jewelry in. We'll wash our hands, and then we'll warm cleansing milk or whatever type cleanser that you can use for a dry skin type or an oily type or normal or otherwise. You'll choose appropriately. And then you can apply cotton pads to the client's eyes to help them relax, keep their eyes closed. Some people have a hard time relaxing and they'll want to try to keep their eyes open. Number one, it's a safety issue. We don't want to get any product in the eye, and it's a bit challenging to have them looking up at you while you're working on their face. So encourage them to relax. And one of the ways you can do this is by putting, a gentle toner on some cotton pads, or just wet them with warm water, squeeze them out, and place them on the eyes. So when we're determining the skin type during skin analysis, we're going to examine with a magnifying lamp. We're going to observe if there's any visible pores. If they're obvious, they have oilier skin. Lack of pores would indicate dry or alopecia skin, which means absence of oil. So here's a chart with skin types. So oily, it's going to have obvious large pores, open and closed comedones, clogged pores, shiny thick appearance, yellowish color, an orange peel texture. Dry will have very small pores or not visible. It'll be tight, poreless looking skin, may be dehydrated with fine lines and wrinkles, dry and rough to the touch. Normal will have even pore distribution throughout, very soft, smooth, lack of wrinkles. Combination, we can have a T-zone where we're forehead down to our nose and chin, we're oilier, and as we extend to the outer portion of the face, it becomes drier. Combination is a wider distribution of obvious or large pores down the center of the face, extending to the cheeks, and then again the pore may become smaller as we go to the outer edges. And of course, acne, there will be pustules, comedones, clogged pores, those kind of things present. And usually acne is accompanied by oily skin, but there are dry skin types that can experience acne too. So acne, again, the pores are very large in all areas. It's considered a skin type because it is hereditary. Presence of numerous open and closed comedones, clogged pores, red papules, and pustules. So with the dead skin cells covering the pore, the anaerobic bacteria will thrive and cause a pimple. So when we're using products that introduce oxygen into the pores, that P. acne bacteria cannot live in an oxygenated environment, so that kills the pore. So that's where your Oxy 5 came from, benzoyl peroxide, those particular ingredients. That's where they came into play when trying to treat acne, because they produce or introduce oxygen into the pore. So we're going to want to see if the skin is dehydrated. Even oily skin can be dehydrated. Just because you're oily does not mean you don't need moisture. You just need a oil-free moisture. So dehydration is indicated by flaky areas of the skin that wrinkle easy on the surface. Gently pinching the skin surface may result in the formation of many lines. This indicates dehydration. It can be caused by a lack of care and proper skincare products, sun exposure, not drinking enough water. So we're going to treat by using hydrators that are appropriate for the skin type. Hyperpigmentation, these are dark blotches of color. Most are caused by sun exposure and hormone imbalances. The use of mild exfoliant sunscreen and avoidance of sun exposure can help. Also, there are products that are out there that will help to lighten hyperpigmentation. Sensitive skin can be thin, red, pink. It turns red easily. It can be easily inflamed. So we would avoid the use of strong products. And there are skincare lines out there that are geared towards sensitive skin types. Rosacea is a chronic hereditary disorder that can be indicated by constant or frequent facial blushing. Dilated capillaries, this is also known as telangiectasia or cuperose, and we should avoid use of avoid use of treatments that release heat or stimulate the skin. Aging and sun-damaged skin. Aging skin is indicated by loss of elasticity, wrinkles may appear, sun damage, hyperpigmentation, wrinkles, and sagging skin will be present. And it's not just the sunbathers or the tanning booth people that can experience sun damage, because we get incidental exposure from going about our daily lives every day. So you really should be wearing a sunscreen every day. So some categorizations of skincare products. We have cleansers. There are cleansing milks, which are more of a lotion, milky viscosity. And then we have ones that are more foamy and soapy. Toners, also known as fresheners or astringents. They're going to lower the pH. They're going to remove excess cleanser, hydrate, and soothe. Some of them may even contain some glycolics or other type of alpha hydroxy acids to help resurface the skin and keep your skin looking clear. So gamma toners, they can contain exfoliating ingredients like I just described. Some can contain higher alcohol contents for oily skins, and they can be applied with cotton pads. Alcohol-free toners can be sprayed on the face. I don't agree with higher alcohol content for oilier skin because, as I've said before, when you keep stripping that oily skin, if it's too harsh, your oil glands are going to go, oh, we're dry, we need more oil. And, next thing you know, you turn around and you're oily again. What you want to do is work to normalize the face, and you want to have alcohol-free toners. That's my opinion. That's what I have experienced in my working career and for my own personal use. So exfoliants, we have mechanical exfoliants that are granule scrubs, gommages, or microderm scrubs. Mechanical as in physical. Chemical exfoliants, we have salon alpha hydroxy exfoliants such as lactic, glycolic, salicylic. Prior home use is required because you want to know that they're reacting okay to the product as is. So mechanical means physically bumping off our dead cell buildup. I refer to the mechanical as a physical type of exfoliant. Microdermabrasion, that's a mechanical exfoliation because we're using a machine and apparatus to lay down aluminum oxide crystals that are bumping off that dead skin layer on the top. So that's how I remember it. Physical, I'm physically doing it. Exfoliant, I'm manipulating it as a scrub. Mechanical, microdermabrasion is a form of mechanical. A gommage is a French word meaning erase. So this is a type of peeling cream that is rubbed off. So you are placing this cream on the face, and as you work it, it kind of starts rolling up or beating up. That's an example of a gommage, and they usually have some enzymatic type of ingredient in there. There's also enzyme, fruit enzyme exfoliants, more of a BHA rather than the alpha hydroxy that people with more sensitive skin can use more easily. They're not as reactive to the stronger AHAs such as glycolic and salicylic and those things. So you will see ingredients like bromelain, which comes from pineapple, papain comes from papaya, and some other fruit enzymes in there that, the acid in the fruit kind of helps loosen up that cellular debris. So salon AHA exfoliants, they're often referred to as peels, and these are generally going to be your glycolics. They're going to be in strength from 20 to 30%. Prior home use required. They shouldn't be used in the salon unless the client has already been using a 10% product at home for at least 2 weeks, because you build up your tolerance. So you just don't want to walk in cold turkey and get a 20 to 30% glycolic peel. All right, so when to avoid mechanical peeling. If the skin has visible capillaries, some people will have broken capillaries on their face. Overindulgence of alcohol can cause this to occur along with rosacea. Thin skin that reddens easily. You know, as we get older, our skin will thin. Older skin that is thin bruises easily. Skin that's being medically treated. You know, if they're using some type of topical chemotherapy because they've had some skin cancer, you definitely don't want to do any mechanical peeling. I would not treat them at all because, again, remember chemotherapy, contraindication. Acne-prone skin with inflamed papules and pustules. You know, mild acne, I would say it's okay to get a facial, but if somebody is really cystic, full-blown, it's not a good idea to do a facial on them. You need to refer them to a dermatologist because, you know, those are localized infections and all you would be doing is spreading bacteria. And you must have hands-on supervised training before attempting chemical exfoliation treatments. Make sure you know how to use that product. Make sure you read directions. Are there videos out there? Did you attend some training with the company that manufactures this particular line? You need to have that background to safely execute a chemical peel because you can burn and injure someone. Enzyme peels, I was just talking about these with the fruit acids. These dissolve keratin protein in the surface cells, and we talked about the papaya, which it would be listed as papain, pineapple, bromelain, and they state here some beef byproducts. They can be a cream type, they can be a powder type. The powder types you would just sprinkle into your hand and you would add water, a little bit of water, and work it and then apply it onto the face. So the cream type usually contains papain that can be applied to the skin, allowed to dry, and then rolled off, which is an example of a gommage. And then the powder type I just described. Proper exfoliation may improve the appearance of the skin in the following ways. It reduces clogged pores and oily skin. It promotes smoothness, increased moisture content and hydration, because when you knock off that dead layer, things are more easily absorbed into the skin. Reduce hyperpigmentation. Decrease uneven skin color because, you know, having dead, drier cells can change the tone of our skin. Eliminate or soften wrinkles and fine lines. So moisturizers and sunscreens, you know, moisturizers, they make them for drier skins, oilier skins. So make sure you're choosing the formula that's appropriate for you. Sunscreens and day protection products and their serum and ampules. And then massage cream. So a dry skin moisturizer has a humectant. They're water binding. They attract the moisture, and emollients help to hold that moisture in. So moisturizers for dry skin will have a heavier cream and contain more emollient. Oilier skins, it's going to be a lighter lotion, and it's going to contain smaller amounts of an emollient. Day protection products and sunscreen are necessary to help prevent premature aging and skin cancers. Daily moisturizers should contain broad spectrum sunscreens. Night treatments, on the other hand, are heavier than day products and may contain a higher level of the conditioning ingredients. Serum and ampules. Ampules are the little plastic containers that you just, you know, twist the little tail off of, and it all has an amount of product in it. Sometimes you can buy products that come in a glass ampule that you just snap off the top. So these are concentrated products that contain higher amounts of ingredients. They are applied before your moisturizer or sunscreen, because if you moisturize first, the serum or the ampule is not going to be able to absorb into the skin. Massage creams. We want to use a massage cream or an oil to reduce the friction and make the skin slippery during the massage, because otherwise it will be uncomfortable. So we want to make sure, you know, that we use some type of massage product in order to help reduce the friction. Some may contain oil, some will be oil-free, some may be petroleum-based. So make sure you're using one that's appropriate for your client. So mask, we have clay-based masks. These are oil-absorbing. Cream masks that contain oils and emollients. A gel used for sensitive dehydrated. It can be a peel-off type or a rinse-off. An alginate, which is often seaweed-based. Paraffin, this is an oil-based wax that we can use with treatment creams. So if you did a paraffin facial, you would apply whatever products, moisturizer, serum, ampules that you're going to put on the skin. You could lay a facial gauze over the face. Some of them come with cutouts for the eyes and the nose and the mouth. And then you would paint the paraffin on top of the gauze, and the heat from the paraffin, make sure it's not too hot, is going to push those products that you've applied deeper into the skin. And then a modelage type of mask can be beneficial for dry, mature skin. These contain special crystals of gypsum. It's a plaster-like ingredient. Think about a cast. And they're used with treatment creams. Some of them will kind of heat up and they harden, and they usually take, about 20 minutes to set. They're beneficial for dry, mature skin that looks lifeless or dull. And massage is not recommended before or after using a modelage mask. One of the lines that I know contains a modelage mask is Repassage, but they have a rubbery mask that goes on before you apply your modelage mask. And of course, there's other serums and things you would have applied prior to the rubbery mask, and then you put the modelage mask on top, and it heats up. So that heat kind of helps to open pores and push things a little deeper. And I knew that I had arrived when I was able to kind of rock that modelage mask off and keep it in one piece. But Repassage is that line, if should you be interested in that. That's just one of many, I'm sure, but that's one I'm familiar with. So clay-based masks are oil absorbing, so these are good for oily combo skin. Cream are often used for dry skin as they contain oils, emollients, humectants, and they don't usually dry. They stay, in a moist state. Alginate, often seaweed-based, they come in a powder form to be mixed with water or serums. They will form a rubberized texture. That's what Repassage is. It's a line that's based on seaweed. A treatment cream, which is a specialty product designed to facilitate the change in the skin's appearance, or a serum will be applied underneath your alginate mask or alginate. So the basics of facial massage. Massage is the manual or mechanical manipulation of the head or body by rubbing, pinching, kneading, tapping, and other movements to increase metabolism, circulation, promote absorption, and relieve pain. So we carry a lot of tension in our face, and I'm always, happy to see someone getting their first facial and understanding just how relaxing it can be. So effleurage, this is our light stroking movement. And when we were in the labs over these past few days, we've demonstrated this. It's rhythmic in manner. Remember, we want to keep it slow and rhythmic. And we can use the fingers or the palms of our hands. Petrissage, this is the kneading movements performed by lifting, squeezing, and pressing the tissue. Friction is a deep rubbing movement in which we apply pressure on the skin with fingertips or palms. Our circle, we did circular friction while we were in the lab. By moving it over the underlying structure, and includes movements such as chucking, rolling, and ringing. These are other variations that fall under the friction. Tappament, this is tapping or hacking. Hacking would be more used on the extremities, your legs, that kind of thing. I'm sure those of you that do pedicures have had them kind of chop on your leg. That's a form of hacking. Slapping on your leg. Vibration is the rapid shaking of the body part while the balls of the fingertips are pressed firmly on the point of application. So motor points, we have motor points in our face. And they're varied locations, and we can achieve relaxation through light, firm, slow, rhythmic movements, or very slow, light hand vibrations over motor points for a short time. And again, these are points on the skin over where the muscle or stimulation will cause contraction, and every muscle has a motor point. So some benefits of massage are skin nourishment, softness and pliability, increased blood circulation, gland stimulation such as our lymph system, stimulated and strengthened muscle fibers. We're working those muscles, and soothe and rested nerves, and it can also help relieve pain. So in your book, you will have illustrations of the different facial manipulations. Um, so make sure that you go over those and review those. I demonstrated some like the crisscross, the circular, linear on the forehead and what have you. So make sure that you go over those and review those movements. You're the choreographer. You can create the dance you want to do in your facial massage, as long as you're meeting all the client's needs. So you don't necessarily have to do all of these movements that are illustrated, but these are forms of different movements that you could use to help create your choreography in your facial. The stroking, the headache movement, again, this is demonstrating different facial manipulations. I'm not going to go over all of them for time's sake in the lecture, but please do review these in your book. And here's some other illustrations also. So chest and back and neck manipulations, because when we're doing a facial, you know, we're going to come down onto the décolleté, we're going to come down to the shoulders, we may slip our hands underneath the client. Those of you that had massages before, you know how they slide their hands a little bit under, just right below the shoulders, you know, to work those areas too. Because again, we're trying to produce relaxation. So we would incorporate these movements in to our facial massage, our facial. All right, so the purpose of facial equipment, we have a steamer, we have a brushing machine, which we can use to do a machine facial. We have skin suction, cold sprays. We have, you know, gone over some of this while we were in our lab situation or setting today. So the steamer is going to produce warm steam. It's going to be focused on the client's face or other areas. It'll soften tissues, making the skin more receptive to moisturizers and treatments. And the brushing machine, that's the rotary electrical appliance where we can interchange the brushes and vary the speed to help work around cleansers and that type of product on the face. Avoid brushing on clients that are using keratolytic drugs with rosacea and sensitive skin, pustular acne, or other skin inflammation. The skin suction, the cold spray, this is used to increase circulation, to jet spray toners on the skin, or you can just spray toner onto cotton pads and apply it that way.